Stand by. This is our 1 minute warning. Stand by.
Good afternoon. Thank you for being here, virtually and otherwise. It was 36 days ago that I convened our coronavirus response team, headed by CDC Director Dr. Nirav Shah, and consisting of the commissioners of DHHS, Defense Veterans Emergency Management, Public Safety, Education, Corrections, Labor, Transportation, and others. On March 12th, Maine recorded its very first positive presumptive test, a case of COVID-19. On that same day, I suspended all non-essential out-of-state work travel by state employees and recommended strongly that any non-essential large indoor gatherings be postponed. On March 15th, 3 days later, Maine recorded 5 presumptive positive tests and 7 confirmed cases of COVID-19, just in 3 days. On that same day, I declared a state of civil emergency and recommended ending classroom instruction in all public schools, and postponing all non-urgent medical procedures, and restricting visitors and all non-essential healthcare personnel to long-term care facilities, and postponing all events with 50 or more people and all gatherings of more than 10 people that had people with higher risk, such as seniors. 3 days later, on March 18th, Maine CDC recorded 43 confirmed cases of COVID-19. On that day, I ordered all restaurants and bars statewide to close to dine-in customers and prohibited all gatherings of more than 10 people and urged non-essential public-facing businesses to close their doors to the public. 6 days later, March 24th, Maine recorded 118 confirmed cases of COVID-19. On that day, I ordered all non-essential businesses and operations in Maine to close their physical locations that are public-facing, meaning those that allow customer, vendor, other in-person contact. And I also urged all large essential public-facing businesses to use strategies to reduce congestion in the stores, limit the number of customers, etc. On March 27th, we reported our first death caused by COVID-19. March 31st, we recorded 303 positive tests and 5 people who had died with COVID-19. And it was on that day that I issued a Stay Healthy at Home directive that requires people living in Maine to stay at home at all times, unless for an essential job or for an essential personal reason, such as food, medicine, health care, other necessary purposes. I also mandated that essential businesses and operations that do remain open limit the number of customers at any one time, and adopt curbside pickup and delivery as much as possible, and enforce the U.S. CDC physical distancing requirements for all customers and employees. On April 3rd, Maine reported 432 cases of COVID-19, and 9 people had died of COVID-19. On that day, I issued a further executive order that mandated travelers arriving in Maine, residents or non-residents, that they self-quarantine for 14 days to limit the spread of COVID-19. And I suspended lodging operations, everything from hotels and motels to RV parks and campgrounds, Airbnb, short-term rentals, except for vulnerable populations. Today, Maine recorded 519 positive tests for COVID-19, 519 positive tests, and 12 people who have died with COVID-19. So today, we're going to announce some further steps that we're taking to expand our healthcare capacity and to ensure that Maine people receive the healthcare they need in the face of this pandemic. But first, I want to turn this over to Dr. Shah to discuss the state's modeling and to give his report today and informing us of those preparations.
Thank you very much, Governor, and good afternoon, everyone. I'd like to start on a sad note. As Governor Mills mentioned, Maine CDC is now aware of 2 additional deaths of individuals who were diagnosed with COVID-19. One was a man in his 50s from Cumberland County, and another was a female in her 80s, also from Cumberland County. All of us here at the State of Maine government extend our deepest gratitude and condolences to those families right now for the grieving process that they are undergoing. As Governor Mills mentioned, there are currently 519 confirmed cases of COVID-19 across the state. 99 individuals have been hospitalized at some point during their COVID-19 illness, and 176 have recovered, an increase of 18 since yesterday. Between yesterday and today, our public health emergency preparedness team has been continuing to fill requests for personal protective equipment to individuals and institutions across the state. Between yesterday and today, 168 such orders were pulled, packed, and are being shipped to institutions statewide. I'd also like to take a moment, as Governor Mills noted, to talk a bit more about the modeling exercises that the team has been engaged in for nearly a month now. The first question is, what is mathematical modeling when it comes to epidemics? And the truth is that many of us are already used to the concept of mathematically modeling scientific phenomena, because frankly, that's what meteorologists do almost every single day. When we take a look at a weather report, what we're really looking at are the results of some mathematical models that our colleagues in meteorology have put together and run through their computers. We do the same thing in epidemiology. We use different models, different tools, in different ways to come up with different scenarios. Now, we use different types of models because, just like in meteorology, each one has its various strengths as well as its various weaknesses. But the reason that we do these modeling exercises is, again, similar to the weather. The value that we derive from watching the weather report is to know how to prepare for the next day. In public health, we do the same thing. The purpose of modeling exercises is to plan, not necessarily to predict. We use models to generate different scenarios so that we can have a sense of how to plan for different allocations of resources across the state. So what do our models show? Well, because we use different models all at once, we are able to generate a wide range of scenarios that help inform our planning. And the one thing that each and every model has shown is that aggressive, intensive physical distancing can reduce the spread of COVID-19 and reduce the demand on the healthcare system. So I'd like to take a moment to thank everyone in Maine for continuing to physically distance themselves and help introduce as much space as possible so we can try to bring down the number of diseases and reduce the overall strain on the healthcare system. Now, why do we do all this, and what do we do with the results that we generate as a result of these modeling exercises? Well, in the same way that, for example, the Department of Transportation might rely on weather models to know when to gas up the snowplows, we in public health do the same thing. We use these models to try to understand how we should plan for and allocate resources. Right now in Maine, we have an opportunity to prevent a larger outbreak from taking hold. That's what these models help us do. They help us shine a light on whether we should be taking a closer look at one particular area of the healthcare system as opposed to another. Whether we should be taking a look at, say, the number of ventilators we have versus the number of ICU beds that we have, and make sure that our planning is taking into account what we've got and where we think things might go. Again, the purpose of all of this exercise is not to predict, but to plan. What we'll be doing in the coming days is continuing to refine the models as more and more data are available, in the same way that it's difficult to predict what the weather might be at noon on the 4th of July. As we get closer and closer to those dates with better and better data, the accuracy of our models gets better, which allows us to have better and better planning scenarios. Happy to take any questions on that, but Governor, I'd like to turn it back over to you.
Thank you, Dr. Shaw. And although Dr. Shaw has been a very effective face for the administration, for the department, I just want to note that there are hundreds of people behind him doing yeoman's work, whether it's contact investigation, retracing people's steps, doing the testing, running the tests, and making this effort run as smoothly as humanly possible. And in my administration more broadly, I just want to thank all the cabinet members, including Jean Lambrou, who's here today, and Heather Johnson, fielding questions about businesses, whether they can close or open, how many customers they can have, and Randy Liberty managing a more than 2,000 inmate population in the prisons, and Laura Fortman, who right now is busy answering the phones at the Unemployment Bureau. But I want to thank Dr. Shaw for his presentation today. The models he's talking about, ever-changing, show us what could happen in Maine based on the actions we've taken so far and on the actions we've taken to prepare. I emphasize could because nothing is certain here. What our future will look like, whether it is a best-case scenario, a worst-case scenario, or somewhere in between, that is all up to us. It is up to Maine people to take our fate and that of our friends, loved ones, neighbors, and families into our own hands. Will we stay home, flatten the curve, and save lives? Or will we endanger ourselves and others by disregarding the advice of doctors and infectious disease experts everywhere who tell us that physical distancing is the best vaccine we have against this virus? State government has put in place the measures requiring physical distancing wherever possible. It is now up to Maine people, all of you, and it is a test of our humanity, and only time will tell whether we pass that test. When it comes to a pandemic, I know that time is a luxury we don't really have and cannot afford. We have to prepare today for what we hope will not come tomorrow. And that's one reason I have directed the Maine National Guard and the Maine Emergency Management Agency to work with the Maine CDC and work with our hospitals to now stand up 2 alternative care sites, one in Portland and one in Bangor, as part of the state's preparations to bolster Maine health system capacity in the face of this virus. We will stand up Portland's Cross Insurance Arena to hold at least 100 beds, and the Cross Insurance Center in Bangor will hold at least 50 beds. Now, for now, adequate hospital beds are available across the state. Those hospital beds remain the first choice for treating all patients in need of inpatient care. We also have at least 184 beds statewide that could be converted to support critical care for COVID-19 patients, especially if they need ventilators. The new beds in the alternative care sites will be located outside of hospitals in the event of a surge in the number of people needing inpatient care for COVID-19. So, with logistical support from the Maine CDC, from the Maine National Guard, from MEMA, and from the cities of Bangor and Portland and Cumberland County, we expect these alternative sites to be set up as soon as next week and to be staffed shortly thereafter. I hope we never need to use these sites, but we cannot afford to wait to find out. Building them now will ensure that if the need does arise, we will be prepared and Maine people will be cared for and Maine people will survive. While these Maine alternative care sites will boost capacity for our hospitals, Maine still needs other resources to mitigate the spread of COVID-19. We will continue to support Maine's healthcare workers and healthcare organizations as they battle COVID-19 and its enormous effect on our healthcare system and on all the people of Maine. As part of those efforts, the Department of Health and Human Services is preparing to take a first step next week to financially support Maine's hospitals in responding to COVID-19 by making $10 million in supplemental payments to the hospitals of Maine. Now, I want to speak directly to anybody out there who thinks they're not at risk, who may think they're too young or too not vulnerable or just not vulnerable at all, that thinks that they're not at risk for some reason or other. It's hard to give up our daily lives and our routines. But today, an emergency room nurse will end her shift with a bruised face marked by endless hours of wearing a mask. A doctor will sleep in her garage, separated from her husband and children in the few precious hours she has at home. A respiratory therapist will complete a 20-hour day tending to people on ventilators and in critical care, making them comfortable, keeping them alive. These are the people sacrificing every day to keep you and me safe. These are some of the people you're saving by staying at home. There is nothing more important you can do for them and for our state. We all want life to be normal again. This Friday is Good Friday in the Christian faith. Sunday is Easter. Later this month is the beginning of Ramadan. Tomorrow evening is the beginning of Passover. Part of the Seder is the ritual of hand washing. I think that truly takes on new meaning this week, in this era, in this environment. I'm thinking about people of all faiths this week and about all of the people of Maine every week. As we light the star above Mount Batty, as we deal with everything from ice cream stands to auto dealers and pawn shops and dog groomers, we know we will hike Cadillac Mountain once again. We will walk the beaches. We will picnic in the parks once again. But not now. Not yet. It is too risky. I am focusing 100% on you, and my entire administration is focused on you and on the people of Maine, on saving you and your family, friends, and neighbors, on the 1.3 million people all across our state, all of whom are at risk. Don't give up. Stick with us. The days are long, but we will get through this. The best way to do that is for all of us to do our part and stay apart. Don't forget to call someone who needs to hear from you today, tonight. Don't forget to hug your kids tonight. Tell them they're insecure, they're not feeling safe right now. Tell them you love them. Give them a hug, no matter what they're doing or saying. Tell them that their governor loves them too. And that's why we need to keep everybody safe. Thank you all for your patience, your compassion, and your courage, and your great cooperation in defeating this virus. God bless you and keep you safe. And may God bless the state of Maine. I think we can take some questions.
Great. We've got 17 of our colleagues from the media.
There aren't that many colleagues in the media.
So we will go ahead and start with Kate Koff from the Ellsworth American. Go ahead, Kate.
Thank you, Dr. Shaw, and thank you, Governor Mills, and to all of you for continuing to hold these briefings. I'd like to ask, this is a question for Governor Mills. I'm wondering, you've mentioned several times in the past that the state is using cell phone data to determine whether or not Mainers are appropriately socially distancing. And I'd like to know if you could talk a little bit more about that data gathering.
Cell phone data.
You know,
The question is, and I always forget to repeat the question. The question is about the use of cell phone data. Cell phone data, where that comes from, how we happen to use it, I think. Would you like to answer that, Dr. Shah?
Surely. Thank you, Governor. We use different types of data sets to try to get a sense of how much physical distancing has been and continues to occur in Maine. And there are some good signs on the horizon. Kate, your question is around cell phone data. Cell phone companies themselves, not the state of Maine, but cell phone companies themselves collect data on how far individuals may be from their home address. They make those data publicly available on public websites that we look at to try to get a sense of how much social distancing is happening. Obviously, those data change on an occasional basis. When those data change, we try to update our models accordingly. But thus far, the data do show that Maine people have been staying close to home, at least according to the cell phone metric. Thanks for that question. I'm going to turn next to Phil Hirschkorn from WMTW.
Thank you, Dr. Shaw. Governor, this one's for you. My question is about essential workers from construction to defense contractors. Does it make sense to let people keep building projects like luxury condos and boutique hotels and exempting them from your quarantine order? Also, has the Navy gotten back to you about your request to give Bath Iron Works a break so it can give its workers a break? I mean, they make destroyers, not hospital ships, and they're also using out-of-state workers now. Thank you.
There's two different questions there. And one is, I think you said, has the Navy gotten back to me about Bath Iron Works?
Yes, as they continue to use out-of-state workers, as do a number of construction companies in Maine. Both industries have in common that they're essential, and they're both using out-of-state workers. And I'm asking you, how much sense do you really think that makes, exempting that group to the quarantine order?
It's not me who's exempting the people at Bath Iron Works, but the Homeland Security definition is regarding critical infrastructure, construction of critical infrastructure. It also exempts as essential services things like plumbers, electricians, and people servicing residences and the like. There's a broad array of so-called essential services. Whether they come from out of state or in state, I think they're doing work that can be done safely. That's my interest. My number one interest is what can be done with physical distancing practices in effect. Our number one focus is just keeping people safe. The quarantine measure is intended to do that as well, keeping in mind that everybody who has an out-of-state license, that doesn't mean they came here for non-essential reasons. Many people are here with out-of-state licenses who are with the Coast Guard, or they are locum tenens nurses or locum tenens doctors who are helping us. So whether they come from out of state or in state doesn't determine whether they're essential or non-essential.
I'm going to turn next to Amy Brown at WERU.
Thank you, Dr. Shah. We've been told that the COVID-19 virus tends to impact older people more, and Maine has one of, if not the oldest population in the country, but the numbers that are being reported here in Maine show that people in their 50s and 60s, and to some extent even their 40s, are testing positive in higher numbers than people in their 70s and 80s. Do you have any explanation for that?
Sure. So, Amy's question is about the age distribution of individuals who have tested positive. Of our now over 500 cases, the average age is about 55, which means that by definition, half of our cases are over the age of 55. Amy, we're in the stage of the outbreak where the numbers are changing very rapidly because of the rapid acceleration, and so all the data are not in yet. But given that half of the cases in the state of Maine are over the age of 55, that puts us very much in line with the epidemiological data suggesting that older individuals, as well as those with chronic health conditions, are disproportionately affected. Thank you for that question. We're gonna.
Can I ask a follow-up to the governor?
Sure, go ahead.
Can I ask a follow-up to the governor?
Please.
What steps are being taken to protect the upcoming elections in Maine?
Oh, good
Thank
question. I'm glad you asked that. The question is, what steps are we taking to safeguard the upcoming election? I should say right now, we've been working on this issue for quite a while and conferring regularly with Matt Dunlap, the Secretary of State, and his team, and learning from the clerks and municipal officers and registrars what their concerns are. Everybody, to a person, remains very concerned about in-person voting on June 9th. And given the various deadlines between now and June 9th, some of which have passed, I believe it is not going to be possible to hold the elections, the primary elections, on June 9th. And what we've been talking about is rescheduling them to July 14th. And at the same time, taking every measure to minimize in-person contact for the purposes of handling that election and making sure that people's democratic right to vote, their very precious right to vote, is not impinged. So we're looking at ways to encourage absentee ballot to the highest level possible, minimizing in-person voting. We'll take these each step at a time. But for now, we're anticipating holding the election on July 14th instead of June 9th. And again, talking to the clerks, the municipalities, and the Secretary of State's office. We've talked to both major political parties about this and be talking more with them later today.
Great. Thanks, Amy. Up next is Steve Betts from the Courier-Gazette.
Yes, thank you. One question people have asked me repeatedly is, you have a stay-at-home order, but is it okay for people to go drive around? If the family wants to drive around, is that advisable or not?
Thank you, Steve. The question is it okay to drive around? In the order, we said in terms of driving, make sure you drive with as few passengers as possible, preferably only family and household members, people you've been in close contact with and are unlikely to catch a virus from, okay? But in terms of carpooling, as people have done traditionally, or picking up your friends around the corner, around the block, and taking and going for a ride, we discourage that. We do encourage people to get out, to enjoy the beautiful sun and the fresh air, listen to the birds. We encourage getting outside and exercising, walking the dog, talking with your neighbors from a distance, and driving driving only with family and household members. Thank you. I hope that answers your question.
Thank you.
Great. Next up is Beth Brogan from News Center. Beth? All right, Beth, we'll come back to you. We will turn next to Paul Dwyer at WABI.
Hi, Dr. Shaw. Thanks for taking the question. A viewer reached out to us and said that she took a test in the middle of March, and then she kept reaching back to her doctor. Her doctor told her that the test was lost. She said that she had heard another case of that happening. Have you heard of any cases of tests being lost? And if so, what's a way to prevent this? And because that would be concerning.
Yep. Paul's question is about tests potentially being lost. Paul, I'm not aware of such occurrences happening. It's important to note that there are now at least 7 entities in the state of Maine that are conducted COVID-19 testing. The state of Maine laboratory, a laboratory affiliated with the hospital in Portland, and then 5 large national commercial laboratories. So I confess I don't know where that individual's test may have gone, but I haven't heard of any reports, at least as to our laboratory, of that occurring, but we can certainly look into it. I'd like to turn next back to Beth Brogan. Beth, are you on the line? Okay, we'll try to come back to Beth in a minute. We'll go to Brad Rogers at WGME.
Hi, Dr. Shaw and Gov. My question is, how will these alternative care sites be staffed, and how will care stack up with, say, Maine Medical Center, one of the top hospitals in the country?
The question is, how will the alternative care sites be staffed, and how will they correlate with Maine Health? And Commissioner Lambrew is here to talk about that.
Sure. We have been working in close partnership with all hospitals in Maine, including Maine Health and Mercy in Portland, as well as Eastern Maine Medical Center and St. Joseph's in Bangor, because we want these sites to be totally linked with the healthcare systems there. They are working in earnest to figure out what their needs are, what type of patients should be there, and what type of staffing is required. That is a work in progress. We at the state of Maine are providing the logistics, the support, and helping to set up these sites, working with Cumberland County, City of Portland, and City of Bangor, but it will ultimately be the healthcare providers in those areas with support from the state. And I will note that our support extends in numbers of ways. Number one, we continue to work with them on personal protective equipment, which is so critical to our healthcare providers. That includes innovative activities like working with the University of Maine system, which has created 630 gallons of hand sanitizers for hospitals throughout the state. It also means trying to tap into our healthcare providers as medical volunteers. To date, about 300 people, medical providers, healthcare providers, have signed up. About half of them could potentially help with respirator management. We are aggressively working with them to, again, support our hospitals. Third, we want to make sure that we've given them the kind of regulatory flexibility. Just before I got here, we got approval from the federal level for a so-called 1135 waiver that allows hospitals greater flexibility, for example, to move patients to nursing facilities to free up those beds so we don't have to use these alternative care sites. And last but not least, we know our hospitals, because of the stay-at-home orders, are seeing fewer patients. So we are trying to make sure that we support them financially to care for people with COVID-19, as well as to sustain their staff and their hardworking workers during this time of crisis. That's why we will be providing $10 million worth of supplemental payments to hospitals beginning next week.
We'll turn next to Samantha Hogan from Pine Tree Watch. Samantha, your line's open.
So my question is, can you clarify who is intended to be housed in these alternative care sites? Is this for COVID patients or would this be for clean patients? And then also, you said that you were working with Maine Medical Center, but what has been your communication with York Hospital where there's also a high amount of cases? Are they also expected to surge into the cross-insurance arena?
Sure. The question was what type of patients will be in these alternative care settings, and are we working with York County and Southern Maine Healthcare Center where there are some patients as well? First, as I said previously, we need to have the clinicians in our state be deciding what type of care gets provided in these alternative care sites. As the governor said, our first priority is to keep them in hospitals. We have some of the best hospitals in the nation, and we think that we have capacity in those hospitals to care for people. As the governor mentioned, we also have 184 beds that are not currently critical care beds that could be converted as needed if we want to avoid, again, using these alternative sites. We are working with Maine Health, which includes Southern Maine Healthcare Center. We are working with the Maine Hospital Association, which represents all hospitals. So our work is statewide. We want to make sure that all of our hospital capacity in the state where appropriate is used.
Thanks, Commissioner. We'll turn next to Don Kerrigan from News Center.
Good afternoon. Dr. Shah, a question. This really relates to the hospitals, but also the modeling you were talking about. You talked about why you model, but with this planning for surge and all the other work going on, do you have an expectation that we are likely to see a big increase in the numbers in the next few weeks? And I guess going along with that, do we, at this point in the outbreak, the epidemic, are you able to see when there could be a peak, or is that too far in the future to guess?
Great. So Don's first question is about what the modeling tells us about what we might expect. And Don, one of the core purposes of modeling in this situation is essentially to plan for different scenarios. The candid answer is that we plan for we run simulations of hundreds of different types of scenarios. It's impossible to know at the beginning of an outbreak which one of those hundreds of scenarios might be the one that materializes. One of the reasons for that is that so much depends on how much social and physical distancing occur. That is really one of the critical variables here. But our job is to make sure that whichever of those scenarios materializes, we've got a plan for it. So we're not sure whether the peak, when the peak will happen, and when it does happen, what it might look like. But again, similar to making sure that all the plows are gassed up, no matter which of those scenarios happens, we are ready to respond and assist our local partners on the ground with taking care of any surge. The same thing can be said with respect to your question about the peak. It's too early right now to know when we might be at the peak. And in any outbreak, whether it's measles or the flu or COVID-19, it's usually not until sometime after the peak is hit that you know that you are at the peak. And that's just because of the way that our data systems work. So once that happens, we'll be sure and let you know. I'm going to turn next to Dan Newman at the Maine Beacon.
Hi, thank you. Yes, Governor Mills, in media reports over the past few days, small businesses and landlords have joined housing advocates in calling for a rent and mortgage forgiveness and an eviction and foreclosure freeze. Mm-hmm. Does your administration plan to do more to address the problems of rent and mortgages coming due?
Yeah, there are two. The question is about what we can do about mortgages and evictions and rents being due. Yeah, there are several things. We've been brainstorming about this every day. And what we're doing is taking a targeted approach. I can't imagine being evicted in this atmosphere at this time in the middle of this crisis, whether it's a shop owner on Exchange Street or an apartment dweller on Munjoy Hill or in Kennedy Park or elsewhere, anywhere in the state of Maine. This is not the right time for any landlord to be evicting anybody. Anybody. So we're doing a couple things. We're looking at a carefully targeted executive order that will stop writs of possession from taking place, from being issued in residential cases, and perhaps in commercial cases as well. We're also, but we're not going to. We can't forgive the rent that's due. We can't say you don't owe the rent. That's a contractual matter. And if law enforcement are involved, obviously, or if people need to be evicted for personal safety or other legitimate reasons, that's a different issue too. But for non-payment of rent, for people who are suddenly seeing financial stress because of losing their job, because of the COVID-19 virus, we are taking actions, and we'll see that shortly. We're also looking to amass a fund, a short-term funding source for payment of people's rental obligations, residential rents in the short term. That measure we'll be announcing in the coming days as well. Thank you.
Up next is Caitlin Andrews from the BDN.
Hi, yes, thank you. I have a question for the governor and a question for Dr. Lambert and Shaw. Governor,
all three of us.
Why? Yes, for everybody. Governor, why choose July 14th as a potential date? What makes you think that would be a good date to shoot for? And what advice would you give to municipalities who don't have voting places right now and who need to make a decision on making a request for a new voting location by Friday? And for Dr. Shaw and Lambert, I would like more information on
can we maybe take it one question at a time? Because I'm going to forget the other two questions. Your first question was about why July 14th. We're looking at, first of all, how much time does it take after the primary to make the filings that are required by law, and then to prepare for the general election in November? What does it take on the part of the municipalities and the Secretary of State and the Commission on Ethics and Election Practices? And then secondly, we're guessing to some extent. I know July 14th is Bastille Day, but it seemed like an appropriate time. It's 5 weeks after the scheduled election, currently scheduled, and it seemed to me we would give people enough time to plan ahead, whether it means using some of that federal money to buy plexiglass barriers for some municipalities where there might be a little more congestion at the polls, whether it means getting the public more informed about how to vote differently this time, whether it means getting absentee ballot requests out to as many people as possible. It gives us that lead time. In terms of the deadline that you say is this Friday, there are a number of deadlines that if you track back from the day of election currently scheduled, a number of deadlines that we are going to have to adjust accordingly. But we want to preserve every Maine person's, every Maine voter's right to express themselves at the ballot box, to cast their vote, and preserve our democracy. And the second question was for Dr. Shaw, I think, or Commissioner Lambrew.
Yes, I just want to get a sense of what kind of equipment does the state have to staff these temporary medical sites, and how long could they last, essentially?
Sure. So Caitlin's question is about the equipment and staffing that are needed for the alternative care sites. Commissioner Lambrew has discussed the staffing piece, but the alternative care sites, as we have them, have certain pieces of medical equipment, durable medical equipment already in them, beds, IV poles, and things like that. The state would also supplement those pieces of durable medical equipment with things like personal protective equipment, depending on which types of patients were in them. Now, in terms of replenishment, there are schedules that are set by the manuals that come with these for how often they need to be replenished. And it varies based on the piece of equipment as well as the number of staff. So I don't want to go through too much, but Caitlin, we've got that information and we can get it over to you in terms of the expected replenishment schedules, as well as, according to the folks who manufacture those, what types of additional pieces of equipment are needed to support those. We're going to turn next.
You had a third question.
I think that was it.
Okay,
Yep.
sorry.
Thanks, Caitlin. We're going to turn next to Steve Missler from Maine Public.
Oh, thank you, Dr. Shaw, and thank you, Governor Mills, too, for holding the briefing. My question is for Dr. Shaw about testing capacity. I know that Maine CDC has been trying to ramp up capacity, and I'm wondering what the status is on that, especially with the introduction of these Abbott tests. And I have a more specific question about, we've been hearing from doctors who say they're telling patients in low risk categories, but who are also exhibiting symptoms of COVID-19 to just basically presume that they have the virus and to stay home. I guess what I'm wondering, though, is are doctors or hospitals providing some sort of a census to Maine CDC to get a sense of how many people are in that category? Meaning, we don't have tests for these folks, but it sounds as though they have all the symptoms of the disease.
Great. So Steve's first question is around testing capacity. And I'll say two things there, Steve. One is that in order to expand as well as to diversify our testing capacity, we recently ordered an additional testing machine to do this so-called extraction process. We're still awaiting delivery of that machine from the manufacturer. They themselves are backed up with orders from other state laboratories. But as of today, the overall the daily testing capacity at the Maine CDC laboratory is around 300 to 400 tests per day. We don't always run that many, but that's the total capacity that we have if we were going all out. Steve, you noted the introduction of the Abbott machine, and I hope to have additional updates for you and everyone else on those machines in the very near future. You also asked about individuals who may have been given what's a so-called a clinical diagnosis of COVID-19 as opposed to a laboratory confirmed diagnosis. Those clinicians are welcome to report those cases to Maine CDC, but without a laboratory confirmed case, they're not required to. As we undertake our modeling exercises, however, we always have some assumption built in about what percentage of the iceberg we are seeing and what percentage of the iceberg we know is out there, but that we're not seeing. And when we run the different scenarios, we vary that percentage based on what we think it might be and how we think it might change. It varies day to day based on what type of model we're running, but we certainly know that consistent with medical standards and advice by the US CDC, clinicians are advising patients in areas where community transmission is occurring who have consistent signs and symptoms, who are low risk, to stay home, and that is consistent with US CDC guidance. And if those patients don't have a laboratory diagnosis, they're not required to report it to Maine CDC, but we do make assumptions in our modeling about the existence of those patients. Going to turn next to Kit Harrison from Mjambo, Africa. Kit Harrison, are you there? All right, we will come back to Kit in just a moment and turn next
Okay, so I'm here. Sorry.
Go ahead, Kit.
Okay, my questions are for you. I know that due to the shortage of PPE, you've had to make careful decisions about who gets what equipment. I wondered if providers in group homes are in the priority group for PPE. A lot of them are going house to house, administering medications, providing other care, and I just wondered if you could comment on that.
So Kit's question is around distribution of PPE. As everyone is aware, PPE is a vital asset, a critical resource that has been in short supply across the country. One of our tasks, working with our colleagues across the state, is to make fair, equitable distributions of PPE to healthcare providers to help them stay safe so they can keep taking care of patients. Our first waves of PPE were designed to equip the least equipped. Now we're focused on trying to figure out where the highest number of patients are who are currently positive, as well as equipping areas like nursing homes where there are especially vulnerable groups. So we're focused right now on these so-called congregate settings. And Kit, to your question, group homes are considered congregate settings. If a group home were, especially if a group home were experiencing an outbreak or even one or two confirmed cases, they are given priority so that we can get them PPE as quickly as possible. Again, our goal is to try to prevent transmission and make sure healthcare workers can stay on the job so they can keep taking care of patients. I'm going to turn next to Kevin Miller from the Press Herald.
Hi, thanks very much. This question is either for Commissioner Lambrou or Governor Mills. Just talking about the $10 million for hospitals, can you talk about, are there certain things that money can be used for, restrictions to make sure that it doesn't go to kind of other things that maybe wouldn't be deemed necessary, or is it only to cover COVID-related expenses?
Sure. And the question was, are there restrictions on the use of the $10 million in supplemental payments that Maine Care will make to Maine hospitals beginning next week? In the bigger picture, we are looking at all of our different providers, hospitals, nursing facilities, group homes, home care, primary care practices to try to assess who is treating patients with COVID-19 and needs that kind of support, who is not treating patients with COVID-19 but whose patients may be staying home because of advice. Can we support them through telehealth? And are there programs like adult daycare where people are staying home and they're questioning whether they can stay in business? So we have a comprehensive strategy that we're working on. The payments that we described today are one piece of that. Supplemental payments in Maine Care are not new. We provide them every year. We are just bumping them up. Hospitals decide the use of those funds. They have to be appropriate uses within our existing framework, and we're doing that because it's quick. We recognize the fact that we need some time to figure out how to smartly identify the costs related to COVID-19, recognize other COVID-19 related costs, and then recognize where there are providers who we want to help get through this hard time. So this is one part of a larger strategy. You'll be hearing more about that strategy from the department in the days coming ahead.
We'll turn next to Ashley Blackford from WAGM.
Thanks, Dr. Shaw. Now, you're breaking the confirmed cases down by county. Why aren't you doing it by the individual cities or towns?
It's a good question, Ashley. Ashley's question is, why are we sticking with the county level and not going below the sub-county level to cities or towns? And there are a few reasons, Ashley. The first one is that one of the things we've learned about this coronavirus is that it spreads very quickly across any geography. We all know now that it doesn't obey international borders. It certainly doesn't obey state borders. It definitely does not obey county borders. And so what we want to try to do is provide numbers at an aggregate enough level that balances giving folks a view into what's going on in their area while also maintaining some degree of privacy as well. So given how quickly coronavirus spreads, given how the fact that we know that it is already occurring at a community transmission level in at least 2 counties and probably more in the coming days, there's not additional public health information that is to be gained in terms of actions that more people should be taking. To put a finer point on that, if you're not sure, if you're in a county where coronavirus is known to be, which right now is everywhere other than Piscataquis County, but you're saying to yourself, I'm just going to wait until someone I know has it, my recommendation is that you've perhaps waited too long. Now is the time to keep preparing. Even if you're not sure whether it's in your neighborhood, you should presume that it's in your county, and you should presume that it's in your city at this point. We're going to turn next to Dustin from New England Cable News.
Hi, Dr. Shaw and Governor Mills. Can you hear me?
Yep, go ahead, Dustin.
The question's for Governor Mills. Governor, what are the questions that you've been asking the federal government on your most recent calls? Have they been on supplies or guidance, and has the federal or White House tone on this changed at all?
Thank you for the question. The question is, what questions have I been asking on the most recent calls with the federal government? And I think yesterday was the 7th call that the governors had with the vice president, sometimes including the president. Yesterday, the president was not on the call. The question I asked was about the Abbott lab tests and those when we can get more of those, more capacity to test for the quick turnaround tests. The point I made to the vice president and Dr. Birx and others on the call was just because we're not a, quote, hotspot, we're not one of the 12 hotspots on the map of the United States right now, doesn't mean we couldn't become a hotspot. And we need those quick turnaround tests now, not later. They are dispersing them basically, more to the hotspots than to other states like Maine, Vermont, Wyoming, Idaho, Montana. My point was we can prevent us from becoming a hotspot if we have more of those tests now, those test kits. And in any case where you have those quick turnaround test kits, you can prevent a depletion of your supply of PPE because, as we know, if somebody has to wait a couple of days to get a test result, you've got to assume that they've got the virus. And people dealing with them, healthcare providers dealing with that individual, has to be fully outfitted with PPE, basically. If you knew within a matter of minutes or hours, you wouldn't use up the PPE in that manner. That was my question to the Vice President. There were many other issues discussed, but a lot of it was about supplies. And you asked if I'd detected a change in tone or something, or change in... I didn't quite get the...
Yeah, change in guidance, anything like that.
There were no new guidance, no new information provided along the lines of guidance. The Secretary of Treasury was on the line. We've been pushing him to give us more guidance about how the states will be allowed to use the relief money that came from the CARES package. We're waiting on that guidance. Over the past weekend, we got additional guidance from the Department of Labor about how the new unemployment funds can be used. We're still processing that. And we got new guidance on how the SBA funds can be used to help our small businesses. And as you know from the reports, well over 1,000 small businesses have applied through their banks for this additional money.
And the last question goes to Stephen Porter from the York County Coast-Star.
Thank you so much, Dr. Shaw. My question's for Governor Mills. It's a follow-up regarding the naval shipyards. We just had the Navy report a COVID-19 death at Portsmouth Naval Shipyard. So I'm wondering what assurance you can give Governor Mills to the public that Maine is working with New Hampshire, other states, and the federal government to ensure that these large workplaces, these engines of our community, are safe from a public health perspective.
Thank you for that question. The question was about not only Portsmouth Naval Shipyard, but other government-owned or industrial contractors such as Bath Iron Works. I've expressed to the Vice President directly and to the Department of the Navy the dire need for the department to become flexible, be flexible in the terms of its contracts with, for instance, Bath Iron Works, in order that we can ensure health and safety at the workplace for all our workers. My condolences go out to the individual who worked at Portsmouth Naval Shipyard, who unfortunately and tragically came down with a virus somewhere and passed away from it. That can happen. That can happen anywhere. But I'm hoping that the Navy will start bending the rules a little bit and allow us more flexibility in performance of those contracts that are vital to our national security, part of the industrial defense mechanisms. They are protected under federal law. They are protected by presidential edict, basically, at this time. All four members of the congressional delegation joined me, and I joined them in several communications with the Navy on this exact same issue. We are pressuring them every day for better flexibility, more guidance, so we can save people's health and safety. Thank you. And I think those are all the questions on the line, and I thank everybody for listening in and watching. These are difficult times for everybody. People staying in their homes is not an easy thing to do over any extended period of time. If you're running out of jigsaw puzzles and things to do, movies to watch on TV, be as patient as you can. It is so critical that we cling together. Whoops. It is so critical that we stay together by staying apart in this time. Every hour, every day, my administration is responding to new issues and different questions and concerns, and we are trying our best to respond to those in a very tailored and balanced fashion. There is no playbook for any of this. There is no coronavirus crisis for dummies textbook, how to do it textbook. But we are doing the best we can, talking with other states, talking with experts in other states and in the state of Maine, and responding as best we can to keep you all safe. And again, we are so lucky to have people like Dr. Shaw and Commissioner Lambrou and so many others at state government protecting all of you and all of us. Please do your part. Stay apart. Thank you very much.